Okay, this is a presentation of the IoT projects in Colombia. This topic has been worked with Jose Roberto Amazonas, the USP University. My name is Ana María Cárdenas. I am professor in the UDA University, Universidad of Antioquia in Medellín, Colombia. Please, second slide, Jose Roberto.
Okay.
I'm going to be very briefly. Our main topic of work with IoT is in environments related to mines and hospitals. In the second and third slide, I would like to talk about advances of IoT in Colombia. This concept was introduced in a workshop organized by members of Casagras 2 project. This was on September 21st last year. It was the first time that we heard about IoT. But some technologies that support IoT are not new in Colombia. For example, RFID is now widely used in the country. Some examples of the use of RFID are for pay toll in highways, in some companies for management inventories, and for control in supermarkets and hospitals, and for example to trace some special coffees by Federación Nacional de Cafeteros here in Colombia. Um, the, there are two technologies that compete, I think, that are barcodes and RFID. But barcode systems are very popular in Colombia because supermarkets impose or are that the uh, business put some stickers with code bars in the products to sell in the supermarkets. RFID is used mainly, mainly for big companies because the cost is a little more high than barcode. Uh, in the slide number 5, we can see that we have RID groups dedicated to a study of development of RFID technology, mainly in logistic, electronics, and telecommunication areas. Related to national policy, there are two big initiatives. Uh, One of them is or promoted by Ministry of ICT, and other one is technologies uh, encouraged by Compass 3547 since 28. This is the state of art in the country. So policies, some groups that work with this topic, but in our case, specifically, we are working in two sectors, mines, because uh, there are very few control systems to detect gases in enclosed space and occurs many accidents in the mines. For that, we are proposing a project for called Ciencias in order to get some support to develop um, a platform to sense gases, to control automatically these gases and detect some um, possible dangers in mines. And the other scenario is hospitals. In hospital, because hospitals in the country are the scenario practice, to make practice that the students need to do, uh, mainly students that are uh, related to healthcare area, and the main problem is to control times access patient that these students has access have access. In this scenario, we propose some objectives to the IPS Universitaria, that is a institution to that manage healthcare services in the country. And our main objectives with the project is to identify students that perform practices in EPS at EPS Universitaria, to control access to the hospital rooms, to automatically record activities performed by the students, to automatically prepare reports indicating promotion or failure in activities, to automatically prepare reports indicating that the student has completed all assigned activities. This is the main proposed with the healthcare system. And the next, in the slide number 10, we see the model that we are using both cases. This model is taken from Casagras project, and this is the, I think, only initiatives in the country specifically in IoT. Okay, this is all. Is very few advances in the country, but I think it's important to say that Casagras was a very important role that IoT are known in the country. Thank you.